Yes, please.
Hi, are you John?
Yes, I am.
And your birthday is January 4th, 1978?
Yes.
Okay, great. My name is Dr. Dennison. I'm a student doctor here at the hospital. I'm here to ask you a few questions about your condition, and I will take some notes. Is that okay?
Yes, please.
Okay, great. Can you please tell me why you came today?
Doctor, I have been experiencing some stomach pain recently.
Stomach pain.
Yes.
Okay, you said recently. When did the pain start?
It has been reoccurring since about a month ago.
Oh, about a month.
But
Okay.
most recently yesterday.
Yesterday. You had pain yesterday.
Yes.
I see. And what triggered your pain yesterday?
When I went to a party at my friend's place.
Oh, okay. So a party. Were you eating anything at the party?
Yeah. I ate a lot of greasy food.
You ate some
Like-
greasy food. Can you tell me what kind?
Barbecue, chicken barbecue, roasted meat.
Oh, okay. And did you also drink alcohol?
Yeah, I think I drank about 5 bottles.
5 bottles of beer or
Yes,
wine?
of
Beer?
beer.
Okay, I see. And you said you had this symptom yesterday. Have you done anything to reduce your pain?
Just sleep on it.
Just sleeping, so you feel better now?
Not really, but at least it lessened.
Okay. Can you explain the stomach pain to me?
It feels like someone is squeezing my stomach,
Squeezing your stomach. Okay.
and sometimes it feels like someone is punching it.
Punching.
Yeah,
Okay.
so much so that I feel like vomiting.
Oh, I'm sorry to hear that. This sounds very painful. Can you show me exactly where you feel it?
About here.
About here. Okay, just slightly above the stomach?
Yes.
Okay. All right. On a scale of 1 to 10, 1 being no pain, 10 being worse pain, how did you feel? What was your score when you last night, or when you felt the worst pain?
Probably about 7 or 8.
7 or 8.
The worst pain.
Okay. And how do you feel right now? What's your score?
About 3.
3. Okay. So it's not so bad now.
Yes.
Okay, that's good. And you said you sometimes you've experienced it over the last month. Is it always during the party time, or do you feel it constantly?
Usually during after party.
After a party, okay.
Yes.
Usually it's after the party.
Yes.
All right. Have you ever experienced this before in any other circumstances?
Probably about 2 years ago.
2 years ago, you experienced something like this.
Yes.
You noticed it. Do you remember what you were eating or drinking at the time?
I first experienced this kind of stomach pain when I was drinking alone at home.
Oh, drinking. I see. Do you have? I want to move on to different questions here. Can you tell me about any previous illnesses or conditions you have?
I used to have ulcer.
You used to have an ulcer.
I'm not sure if I still have it now.
Okay.
but,
When were you diagnosed with an ulcer?
About 3-4 years ago.
3 or 4 years ago. And did you get treatment for that?
Just tablets.
Tablets.
And
And was
like,
that helpful? Those tablets?
It was.
Okay.
The doctor also recommended to change my diet a little.
Okay. Have you done that?
During that time, yes.
Okay. So at the by changing your diet, your symptoms reduced.
Yes.
I see. Okay. Do you have any other illnesses?
None that I can recall.
Okay. And in addition to your stomach pain, did you have any other symptoms that you would like to talk about?
Just like what I said earlier, doctors, oftentimes when I feel the stomach pain, I feel like vomiting.
You feel like vomiting. Oh, I'm
And
sorry.
at the same time, I feel nauseous.
Nauseous. And this always is connected with the stomach pain.
Usually,
Okay.
especially recently.
Okay. Good to know. Do you have any allergies?
I do have some medicine allergies, specifically paracetamol.
Okay. Have you been immunized? Are you up to date on your immunization?
Yes,
Okay.
I believe so.
Okay. Great. I would like to ask some other personal questions about your life in general. The first one is about your family. Do you have any illnesses in your family?
My father has been diagnosed with hypertension,
Hypertension?
chronic hypertension.
I see.
And my mother has type 2 diabetes.
Oh, okay, I see. But they're alive and well?
Yes.
They're alive and well. Okay, that's good to know. You told me that you do drink alcohol. How often do you drink alcohol? How many times a week?
Probably 2 times, 3 times a week.
Okay, and how much alcohol during those times?
About 3-4 bottles of beer
Per day? Per
session.
session per day? Okay, great. Do you smoke?
No.
No smoke. Do you do any recreational drugs?
None that I can recall of.
Okay. How is your work-life balance? Do you get enough sleep?
Sometimes no, especially when I party, I usually only get to have around 3 hours of sleep.
And how often do you party?
Once a week at least.
Okay. And your stress level at work?
Sometimes.
Do you get some exercise?
Not really.
No, you don't get much exercise.
Yeah.
Okay. All right. Thank you very much for these questions. I would also like to point out that you do seem to be drinking quite a lot of alcohol, and maybe your diet is a little bit greasy, and so that's a concern for me, especially since you've been diagnosed with ulcers. So I highly recommend that you adjust some of your diet to reduce some of those symptoms. It might be very helpful. For right now, we do want to give you some antacids and give you, even maybe if that doesn't work, give you some H blockers, which are a little bit stronger. Do you have a preference?
Yes. I think the H blockers.
Okay, I will give you that. Our time is up for today. Thank you very much for your time. I hope that your stomach pain is reduced and you feel better soon.
Thank you very much.
Thank you very much.